Hello everyone, it's Monica Helt with your weekly risk rating scale and metric review. Today is Tuesday, March the 2nd. I will be moving my updates to Thursdays and we'll be covering various health topics, but we will keep our metric reviews on Tuesday. I am going to hand off the reins today though to our wonderful epidemiologist Joshua Robinson. Josh comes to us with a wealth of experience and knowledge. He has graduated from DePaul University. He has a master's degree in public health epidemiology from IUPUI. He worked for the VA for a number of years in data analysis and research both in Indianapolis and in Washington, D.C. And he recently was finishing his doctoral work at the London School of Tropical Medicine and Hygiene in public health. So we're happy to have him, and I will let Josh take it from here. Josh?
Hello everybody, I'm Josh with the Fishers Health Department, and I'll be taking over reporting on the Community Risk Rating Scale. So today is March 2nd, 2021. Today, I'm pleased to announce that our metrics have remained low enough to move our community risk rating from a level 4 red to a level 3 orange. It's definitely been a long winter where we saw huge spikes in cases, case incidence rate, and other metrics from the end of October through November, December, and parts of January. Thankfully, rates have been declining over the last few weeks, and this is definitely due in part to your continued support following public health mitigation strategies such as wearing masks, not congregating with others outside of your home, physically distancing, washing your hands, sanitizing. Please do continue all of those activities as we move down one risk level. So to remind you, our primary metrics that we use to inform the community risk rating level are the 7-day percent positivity for Hamilton County and Fishers and the 14-day rolling average case incidence rate per 100,000 people for Fishers. So these three primary community transmission metrics were in orange last week. They're in orange again this week. The Hamilton County percent positivity is at 8.7%. Fishers is at 6.5%. The 14-day case incidence rate per 100,000 is at 15.91 cases. So we've seen these metrics go down over the last few weeks. That's definitely good news. There have been 133 new cases in Fishers over the last 14 days. So in terms of our public health capacity metrics, these remain almost all in green with testing availability at less than 1 day at our testing site. Turnaround time for tests remains still below 2 days. Our Fishers contact tracing team is able to contact trace in less than 24 hours from notification of a positive case. And the only metric that isn't in green under this is the state contact tracing, which takes a bit longer. The healthcare system capacity metrics are also in green. So we've seen a continued decline in important metrics in terms of our healthcare system capacity and a decline in hospital bed usage for COVID-19 patients in District 5. So these declining rates are definitely all positive news. As I mentioned, it's been a long winter and one for which we experienced drastic increases in our primary metrics and strain on our healthcare system. While we're able to move the community risk rating level down to 3 in orange, it is important that we remember that we all are in this together and we need to remain vigilant in our efforts to protect ourselves and our community. Please refer to our community risk rating guidance on our website where you'll find corresponding information for activity levels based on our community risk rating of orange. So I just want to mention that Monica and her team continue to strive tirelessly to secure more vaccines for our residents. As you know, our vaccination site is up and running. We're administering shots throughout the week. We administer these shots based on those that are deemed eligible by the Indiana Department of Health. This eligibility criteria is rapidly expanding. If you have questions, please visit our website, call 211, or call the Fishers COVID-19 hotline at 317-595-3211, especially if you need any assistance regarding getting a vaccine appointment if you're in one of the eligibility groups. So, as this is my first update, I'll stop here reviewing just our community risk rating scale. I would like to lead with a message to say that even though our cases are dropping and certain rates are declining, we do sit on a precipice in terms of combating this pandemic. Vaccine rollout is increasing. We are seeing these declining cases and rates, and this definitely gives us a sense of accomplishment. And there is much for which we can be proud, but our work, both as public health professionals, and the work of all of us as a community is not yet over. Our health and public health leaders have asked much of the community and of you over the last year, and we thank you ever so much for your efforts to follow evidence-informed public health mitigation strategies. Now more than ever, I think it's important that we renew our vigilance to protect ourselves and our community as new variants are spreading, several of which that are more contagious than the predominant strains, and we have not a clear picture as of yet on how current vaccines or immunity from prior infection will protect against these new strains or impact community transmission. We do all need to remain very vigilant, wear our mask, wash our hands, physically distance from those outside of our household, and take all the precautions that we can to help combat this pandemic. Please email us at healthdept@fishers.in.us with any questions or suggestions. We are here to help you. We are here to protect the community's health and well-being. We hope that you take care, be safe, and until next week, goodbye.